Hi, I'm Dr. Piazza, and I'm in Austin, Texas, and speaking about saline and silicone breast implants at my Austin Plastic Surgery office. What I have for you here today is I have both a saline implant and a silicone gel breast implant. And I want to explain some of the basic differences between these implants. When we look at the saline implant, actually this is a great device that's been around for quite some time. The outer shell is actually a silicone elastomer. So it has a silicone outer shell, but the volume inside is actually saline fluid. This has a little valve, and these come flat to us in the operating room, and we actually place these inside the patient, usually through a smaller incision, and are able to then inflate or add volume to this breast implant in order to get the desired fullness that we want to achieve. Now, what I'm going to do is I'm actually going to show you what it looks like when we actually have a hole in this implant. Typically, if this implant was to deflate, take a needle. If this implant was to deflate, what we would notice is that it would slowly start to drip a little bit of saline. You can see here we have a little drop of saline, and I'm pushing on the implant to kind of demonstrate that it was a slow leak. Now, this could happen over several days to even weeks, and some patients may actually wake up and have a completely flat breast or loss of significant breast volume. Now, to speed up this process, I'm going to show you what happens when we fully have a deflated implant. I'm actually going to take a knife here and nick the side of this implant so you can see that's just saline fluid. This is the same thing that's in your IV, okay? So if you were to get IV fluids, whether you were sick or whether you were going to go have elective surgery, typically what would happen is that this fluid would just be absorbed by the body. It's basically harmless, and the same thing again that we give you in your IV. So as this implant slowly deflates here, I'm going to show you what it looks like. It actually gets quite flat, which is really nice because it can allow us to place this through a smaller incision in the breast. This will be different as we compare this to silicone gel breast implants. So here we have nearly deflated implant here, and this was what would happen if for some reason the implant ruptured or had a leak. You'd be left with almost a near empty shell. And so what we're left with is just this outer silicone, just like this, okay? And when we place this inside the breast, we're going to want to fold it up and place it so you can see how the incision could be quite small in order to get this into the breast. Now let's talk a minute about silicone gel breast implants. This is our newest generation or most modern generation silicone gel breast implant. These are also known as either the gummy bear or the more form stable type implants, as the gel is really a little bit thicker than it was before. It all has to do with cross-linking of the silicone itself. So the outer shell is similar to that of a saline implant. It is a silicone elastomer shell, and the inner silicone is a lot different than it was previously. I've heard stories that women complain that they're worried about silicone running out of the breast, and that's not necessarily going to happen. And I'll show you actually a picture or really demonstrate to you exactly what happens when we cut this in half. So what you're going to see here is I have this implant, and I'm going to take a knife, and we're going to try to cut through this implant. Okay. You can start to see that some of the inner silicone gel is now being exposed, and it does a little bit difficult to get through, but we are getting there. Almost there. And it looks like it wants to run everywhere, but you'll see once I completely cut through this that we're going to have two complete halves here. And there we are. So you can see that the volume is actually maintained, and we have, even the shape is maintained, and we have two halves of a silicone gel breast implant. So when I squeeze this, it's going to want to come out, but then it kind of comes back into the actual outer shell. So this is the difference between silicone and saline breast implants. They are both safe devices as deemed by the FDA for breast enhancement to increase breast fullness and increase breast volume. I hope this has been informative, and if you have any other questions, please don't hesitate to give me a call or shoot me an email.